Hi, my name is Asieh Golozar. Here I'm going to continue on what Rima just talked about and show you how we use the oncology module for detailed cancer-specific analytics in the OHDSI network setting. So let's get started. So as you all know, observational cancer research is challenging and it's not like other conditions. All of us in a daily setting, we're faced with questions like this. What is the overall survival for patients with non-metastatic carcinoma of the neck of bladder in remission after first line of gemcitabine-containing chemotherapy? As you can see, there are a lot of details here that's necessary for us to identify the patient population and also look into outcomes. Let's go over it very quickly. So here we have carcinoma, which is the histology of the disease. It's carcinoma of the neck of the bladder, anatomical site. We also have the tumor attribute, non-metastatic state of the disease. Disease in remission, so we have the condition episodes. First line setting, that's what we're interested in. So we need information on treatment episodes, the type of treatment or regimen, and finally the regimen contains gemcitabine, so individual components of the regimen. So this information is now available, this level of details within the oncology module. Just a very quick recap about the oncology module. The module has three components: cancer disease model. This was introduced and helped us with identification of cancer diagnosis using a combination of base diagnosis and diagnostic modifiers. We introduced cancer treatment model, which enables us to define composite level treatment information, treatment regimen, for example, in addition to individual level information on drugs or procedures. And finally, we introduced cancer episode models. These are essential for conducting cancer research, and you heard about it in Rima's talk. So all these three components provide us with enough details, everything that is necessary to conduct comprehensive cancer research. So we use that to do a study on bladder cancer and describe patient population outcomes. Why bladder? Simply, bladder cancer matters. It carries a large burden on the society and is one of the most common cancer, the top 10 most common cancer worldwide. In general, the disease is usually confined and the prognosis is very good. However, in around 10% of the patient population, the bladder cancer presents itself with metastatic disease. At this stage, the prognosis is very suboptimal despite all the treatment regimens that are available, which are limited. We are seeing an increase in the introduction of new treatment modalities in the recent years, but there are also treatment disparities, and there's clearly a gap in the data and knowledge on the epidemiologic characteristics, treatment patterns, and outcomes of these patient population. So now we can do standardized cancer research using the oncology modules. So we took advantage of that to do a network study on bladder cancer patients. Our data come from different settings and also different geography. We had data from the US academic EHR centers that were linked to tumor registry. We also had data from South Korea academic EHR. In addition to that, we had nationwide commercial data, both claims and also EHR. So to do this study, we took advantage of all the new vocabularies that were introduced by the oncology module to be able to define metastatic bladder cancer more accurately and further identify those who have started systemic anti-neoplastic agents. To identify the treatment regimen, we look and use the individual drug exposures and use this. And the regimen, using a regimen detection algorithm, we define treatment regimens from the first line and also the subsequent lines of therapy. So all this information enabled us to identify specific episodes in patients' journey that are required to define outcomes and characterize outcomes. Specifically, we're able to identify time from the initiation of metastatic disease to the start of the treatment or diagnosis to treatment interval, time from the start to end of a treatment and the start of a treatment to subsequent treatment, and finally the treatment-free intervals. We use these to define certain outcomes, such as time to treatment discontinuation and time to next treatment. So in our data, in our study, we were able to identify more than 11,500 metastatic bladder cancer patients who started systemic anti-neoplastic agents as their first line of therapy. The median age at the time of metastatic disease across databases were between 52 to 69, and between 61 to 84% of our patients were men. This is consistent with what we know about the epidemiology of the disease from the literature. The follow-up time from initiation of the treatment, the median was between 340 days in open claims to 474 days in OHDSI. We were able to identify up to 16 distinct treatment regimens in the metastatic setting across data sources. Here, I'm only showing you the distribution of the top treatment regimen in the first and second line settings, and we're only showing those data sources that have enough information to characterize specific treatment regimen. What's very important to note to see here is that within the US, our US databases, irrespective of the setting, academic, commercial, claims, or EHR, we see similar distribution of treatment both in first line and second line. There are, of course, differences between what we see in South Korea compared to the US that can be attributed to differences in treatment guideline or practice pattern. We're also looked into certain outcomes, as I said, time to treatment discontinuation, which is shown in the upper left side corner, and time to next line of treatment here. I'm going to blow up one to go over it quickly. So gemcitabine and cisplatin. The plot shows both time to treatment discontinuation and time to next line of treatment across data sources, but enough patient population that enables us to describe this. Again, important to notice is that both outcomes, the pattern, are very consistent across setting and data sources. So, in summary, we are ready. The oncology module is ready to use and conduct observational cancer research. It provides necessary details and also the foundation that's required to answer a series of questions in cancer, from describing the cancer burden, patient characteristics, their treatment pattern, regimens, and the dosing sequences, the administration of the treatment. We can use this as benchmarking, and we're able to address outcomes. So with that, I'd like to invite you all to join us, bring your interesting questions, and let's do some cool research together. Thank you very much for listening, and enjoy the rest of the symposium.